What is drug compounding, and why is it essential in healthcare? In this episode of OCuTALK, pharmacist in charge Paula Hooper will explain what sterile and non-sterile drug compounding is, what compounded drugs are used for, and the quality control measures in place for all compounding pharmacies. Hello, and welcome to OCuTALK. Today we're going to be talking with Paula Hooper, PharmD, who is the pharmacist in charge at Primera Professional Pharmacy. Paula, welcome.
Welcome. Thank you so much.
To get us all started, can you tell us a little bit about yourself and your background?
Certainly. I received my PharmD from the University of Houston, native Texan, and I've been involved in pharmacy and specifically compounding in different areas, sterile, non-sterile compounding, community hospital, manufacturing for 18 years. So as the pharmacist in charge at Primera Professional Pharmacy, I'm able to use that experience that I have in helping to treat patients and finding solutions.
Nice. Well, that's perfect because today we wanted to talk about compounding. So what is drug compounding and why is it important for healthcare?
Well, compounding has been around for decades, centuries actually, and community pharmacies have been compounding. It's essential because we meet a need of what commercial available medications just may not be ideal for the patient that is at hand. So we take a patient may not be able to have the commercially available because of the strength that it is available in or the dosage form that it is available in, or they may have some sensitivities to it. So compounding, we're able to change that up. We're able to use different drugs, different delivery systems. Under the Primera Professional Pharmacy, we compound by prescription. So we work with the doctor to identify what exactly that the patient needs and what would be helpful in treating them.
So what are the unique benefits of custom compounded medications?
Well, some of the benefits I addressed earlier would be if they're not able to take the strength that is available. So a commercially available product, the strength may be too high, maybe depending on where they're treating, or they may need a higher strength than what's available, or they may need a different type of way to put it on or administer it, and they're not able to dexterity-wise. So we can take what's commercially available, and we can compound like oral tablets. We can change a tablet into a solution, a spray, something topical, just whatever can help serve the patient better. We take multiple medications combined into one, so we can make dosing schedules easier for patients, and they're able to use and actually benefit from adhering to the schedule now and get maximum benefit from the medication.
That sounds really wonderful. Can you tell us about sterile compounding? What is sterile compounding?
Well, sterile compounding is whenever the medication needs to be of a higher quality, completely free from bacteria or particles. And so sterile compounding is it's compounds that are done in a clean room environment, specifically controlled environment to ensure that no airborne particles or people introduce anything harmful into that product.
So what are some common uses for sterile compounds?
Sterile compounds are whenever the medication is required to be taken internally. So think of infusions like IVs, intravenously like shots, even wound care like wound irrigations that needs to be sterile, and more commonly eye drops and ear drops also need to be sterile.
Why is the sterility so important for these particular drugs?
Because of the route of administration is directly into the body, into the vein, into the eye, we want to make sure that we're not introducing anything harmful or any microorganisms. While we're treating the patient, we also don't want to cause anything else.
When should doctors consider prescribing a sterile compounded drug?
When they need to treat directly into the body. With eyes, that's very common to treat directly into the eye. So those would always be sterile. Directly into the ear would always be sterile as well. So basically, if you've tried other treatments, if it's a topical treatment, then it's not, you need something more severe or more aggressive in the treatment options, then you would probably switch to a sterile.
Okay, that makes sense. So now, can you tell us what is non-sterile compounding?
Yeah. Well, non-sterile is whenever sterility is not a factor. So think of external uses, so oral and also topical. So non-sterile is the same thing, combining the medications in the exact strength that was prescribed and combining them in the form that is needed. Since it's non-sterile, and sterility is not a concern, the environment that it's compounded is not as strict. There are still standards and regulations that are required, but just not as strict.
So what are some common uses for non-sterile compounded medication?
Well, common uses and fields that are compounding would be dermatology. It's very popular in dermatology, which also kind of integrates into eye health, eyelid health. Podiatry is another one, orthopedics. Non-sterile really helps address, and sterile as well, but helps address any type of pain management, infection, inflammation, things like that nature.
That makes sense. How does non-sterile compounding meet specific patient needs? Could you provide us with an example?
Sure. Well, if we take eye health, eyelid health, for example, we don't have to administer directly into the eye, but we can treat directly in the eye region. And we can add whatever is needed to be treated. If it's specific to an infection, we can add an antibiotic. If it's specific for pain or inflammation, we can add a non-steroidal anti-inflammatory or possibly even a steroid. But getting directly at the site of administration and where the infection or what needs to be treated often shortens the amount of time and also makes it easier and faster for the patient to use.
So what are the primary differences between sterile compounding and non-sterile compounding outside of the clean room conditions?
Outside of the clean room conditions would really be the area that you're treating, what you're treating, and the route of administration. Remember, sterile is going to be directly into the body, so you won't want to introduce any type of bacteria. Now, if you're treating something topically and you still don't want to, you want to be a little more cautious and more aggressive, you could compound that as sterile and just apply topically. But really the main differences are how you're going to be administering it, and then that dictates how it is compounded and what conditions it's compounded under.
So now back to the clean room versus non-clean room, the sterility. What are the safety controls? What are the measures for both sterile and non-sterile?
Both sterile and non-sterile have certain standards and requirements. Of course, sterile is a little more aggressive. And so we're licensed by the state boards of pharmacy that we are located in, and any states in which we ship to. So we're also licensed by those states. So they all have different rules and regulations, and standards specific to sterile and non-sterile compounding. We also have fall under FDA regulations for 503A compounding pharmacies, and that requires certain things, but more specifically prescription. We have to compound by prescription, and we have to compound with ingredients or active pharmaceutical ingredients, we call them APIs, that are produced and manufactured in FDA registered facilities. That's both for sterile and non-sterile. Sterile environment and the clean room environments, we have to monitor those rooms. By design, it is to eliminate as much as possible airborne potential microorganisms or anything that as people working in those environments can introduce. So that means gowning, that means the way that we compound. Staff, pharmacy technicians, and pharmacists have to be trained and qualified over regularly. So your clean room environment is going to be certified every 6 months, monitored daily for temperature, humidity, pressure, those type of things. And then the pharmacy staff is trained and qualified every 3 months in a sterile environment. For non-sterile, we also have room requirements. We do monitor those daily. Particular counts or particle counts in those rooms are a little lower, but we also have to train and qualify the room and the people working in that environment.
That sounds like a lot to keep track of.
It can be. But as long as you're following and aware of what those standards are, then it's necessary, absolutely necessary to ensure that there's quality product and that for patient safety.
So how can patients and doctors ensure that they are receiving safe, high-quality compounded drugs?
Well, I would suggest talk to the pharmacist at the pharmacy, talk to the staff, and ask them, are you testing your products? What standards do you follow? We also at Primera Professional Pharmacy are accredited by the National Association Board of Pharmacy. So it's also known as NABP. And so we've earned that extra accreditation for sterile and non-sterile compounding. What that means is they have standards as well. They inspect us as well, and they make sure that we're meeting those standards and actually staying up to date to changes in standards. So ask if they have any additional accreditation. Also, in talking with the pharmacist and the staff, you'll know right away if they're not familiar with compounding. Because quality is so important, it's actually built into the product. So training is very important. Make sure that they are training. If you have a website, look at that website, see if the pictures on the website, if they are of the pharmacy, make sure it's clean looking. It's the whole environment, the whole picture. Also, because communication is absolutely important in talking to these pharmacists and pharmacies. If they're open and willing to explain their processes, and that really gives you a window into their ability, their knowledge base, and overall, if the quality is there, it should be apparent.
All right. So communication is key.
Yes, absolutely.
So what does the patient need to know about taking compounded medications?
Well, because these are unique to you, they've been in working with a doctor and specific to what needs to be treated and how it needs to be treated. These are customized medications specifically for you. So it does take time. We may get a prescription. It may take time to formulate that. It definitely will take time to do necessary testing for releasing. If it's a sterile, that may take several days. But we try to identify what we have on hand, what we can do quickly. So we want you to have your medication as quick as possible, but it may take several days. Compounded medications aren't generally covered by insurance, and so you'll be given a cash price. You may have an insurance plan that will allow you to submit it to your insurance, but that's not always the case. So just be aware that that's a possibility. It's not going to be covered by insurance. Also, the pharmacist will want to talk to you about your medication. Again, this is specific to you. We want to make sure that you know exactly how to dose it, how to use it. The container that you receive it in maybe look like something you've never had before. And so we want to make sure that you know how to be using the medication the best way possible. We want to also know if you have any issues or maybe something that hasn't come up before. During that consultation, that is be very important for us to identify those problems that potentially may come up or needs to be addressed before you take the medication. We also want to follow up with you. If we've not reached out to you, but you do have a question or a concern, give us a call. We want to make sure that if you're taking the medication and you're still not seeing, or you're having an issue, or you're still not seeing resolution, then we might need to go back in and adjust the formulation or get with a doctor to do that, because this is all by prescription. So the pharmacy is going to want to be a key part of the doctor-patient pharmacy triad. So we just want to keep everybody in the loop and make sure we're all on the same page, because at the end of the day, we want to make sure what we've done is actually helping you and you're benefiting from it.
Well, that sounds perfect, honestly. So as an average patient, how do you determine which compounding pharmacy you're going to use? How do you go about locating your pharmacy, or is that something the doctor does?
That's something that the doctor generally do, because we want to work with the doctor and find out in customizing medication what's been tried, what's been failed, why do we need a custom medication. We'll do research and we'll see, okay, is this even possible? Is this medication the best for this what you're wanting? Can we formulate it into that? And so there's a lot of time and energy into that formulation. And that's why it's important for the pharmacist and the doctor to really collaborate on that. It's not just give them this, here, figure it out. We want to make sure that we are working closely with the doctors and making sure, or the providers, and making sure that the solution we've come up with is actually something that they agree with as well. So we'll do a lot of research into that. A lot of doctors and providers that are treating things, these are some things that are recurrent that they're seeing. And so a lot of that legwork has already been done. And they'll remember, I had a patient recently that had this, and this is what we did. You might be a candidate for that. And so they've already worked with a compounding pharmacy. Of course, a patient has every right to go to any compound pharmacy. So if you've already have a relationship with a compound pharmacy, that might be an option as well. See if they're able to do this type of compound. But then ask these questions, go and see if they're accredited by a third party that's independent of the state boards of pharmacy. Ask questions of the pharmacist. Also look and just how's the communication between the pharmacy? Are you able to get in touch and actually speak with the pharmacist when you need it? Is the staff knowledgeable, courteous, that kind of thing? When you get your medication, you want to make sure that the label is clear. You know what you're getting. It's been explained to you how to take it, how to store it, things like that. Those should be very transparent. And a compound pharmacy, you want that type of transparency.
Well, thank you very much for filling us in on all of these things about compound pharmaceuticals. Is there anything else you'd like to tell our audience today?
Well, I would say it's exciting with advancements in technology and research, and it's really, I think, call it thinking outside the box. When you're presented with a patient that has tried things or failed things, has sensitivities to something, it's really exciting to work with the doctor and collaborate with the patient and doctor and find out what's the best way that I can solve this problem for this patient and give them the best possible treatment options. So it's very exciting. Pharmacists and technicians, it's like creating something new. And so we do have guidelines and everything that we have to follow to ensure that the best possible medication and compound can be given and provided to you.
Well, thank you very much for joining us today, Paula. It's really been a pleasure, and I think our audience is really going to love this addition to the series.
Absolutely. And like I said, communication is very key. So if you have any questions, reach out to your pharmacies, speak with your pharmacist, and we're here to help.
Thank you very much.
Thank you.